Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, with season change, many suffer cough and cold, and the change in weather and hot days and cold nights have resulted in increase of such kind of diseases. And also we often hear people complaining about stomach problems. So viewers, today we have in our studio Dr. Manideep Dey, Bachelor's of Homeopathy Medicine and Surgery, and we are going to talk about homeopathy and how it helps in curing cough and cold, stomach-related problems and much more. So not to waste any more time, I'll straight away move to him and talk more about the topic which we have taken. All right, Doctor, welcome to Good Life, the health show. It's a privilege to have you in our show.
Thank you so much.
So today we are having something different kind of conversation that is on homeopathy. So first of all, I would like you to introduce about homeopathy to our viewers of Good Life, the health show, with a just short briefing.
Basically, homeopathy is a system of treatment that internally, not only externally, internal healing is also simultaneously being done.
Okay.
And it was founded by a renowned homeopathic physician, Christian Frederick Samuel Henneman.
Okay.
And in the year 1769. And till then, homeopathy has never looked back.
And maybe now also you are going on the researches with it.
And it's very gentle, permanent, and if medicines been selected properly, it acts as a magic.
Okay. And if we talk about the benefits of homeopathy and how does it work, so what would be that, doctor?
Homeopathy basically it heals internally. And it's harmless, and the medicines have been derived from, majority of medicines have been derived from minerals and this is called plant sources.
Okay.
So as such, it doesn't have any side effects.
Okay, so that is the main problem, point, that it doesn't have any side effects, viewers said, and this is one of the major reasons why people are opting for homeopathy, and nowadays it's very much in which has been got into news as well, isn't it, doctor?
Yeah.
So just to remind in between of our show that our phone lines are open and the numbers are flashed on your television screens, viewers. So if you have any queries regarding the topic, and today the topic which we have taken is regarding and related to homeopathy. So any questions, numbers are flashed on your television screen. So please call up and ask, and your answers will be given by our doctor who is inside the studio right now. All right, coming back to you, doctor, again. If we talk about like some of the common diseases, what would be that, and how is homeopathic helping them to cure it?
Yeah. For example, let's start with a few common diseases, like say in Northeast, allergy-related problems are very rampant.
Okay.
For example, let's start with say one of the important. Many patients are coming to a problem with a history of allergic rhinitis.
Allergic rhinitis.
Yeah, allergic rhinitis and associated sinusitis and all. Allergic rhinitis basically it's inflammation and infection of the nasal mucous membrane. Thereby, the patient tend to suffer from sneezing, irritation of nose, this watery eyes.
And this is because also about the season changes and when it is like hot days and cold night, isn't it, doctor?
Yeah.
Okay.
In temperature variation and Northeast being a humid weather, this sort of problem becomes rampant. So as such, homeopathically, first of all, we take a history of the patient. Mental and physical aspect is very important in homeopathic course of medication. So after that, we select medicines on the basis of totality of symptoms, and it's being permanently cured.
Okay. And
as few management that patient has to pursue with that exposure, further exposure to cold, this indiscriminate use of this called junk foods and all, this further aggravate the scenario.
We'll talk on that, how to take precautions and everything on that, but the basic things are that cold, cough, which is much prevalent in Northeast, as you have already mentioned, because of the weather changes. Okay, we'll have a conversation, but right now we have a phone call, so let's see who is calling. Hello, who's calling? Hello?
Yeah, hello.
Hello?
Yeah, hi, hello.
Yeah, hi. Yes. Who's calling from where?
I'm Shahnaz. I'm calling from Itanagar.
Okay, yes, Shahnaz, what's your question?
Actually, I have a baby. He's 2 years, 6 months. He's having some, snoozing kind of sound in his, like when he's running or, when he just take a hold when he runs. So I just want to, he coughs also in between when he runs, and he's having a mild, coughing problem also. So I just want to ask doctor, he can give me some remedy, what I can do.
Ma'am, how old is he?
He is 2 years, 6 months.
2 years, 6 months. So this is a perennial problem with people residing in this part of the country.
Okay.
So as such, few homeopathically this again on the totality of symptom we choose the medicine, and at point of time things get okay. But few medicines right now I can tell you, but it's better to see
the child and then you can
have a cross check of the child, then give medicine. Few seasonal medicines like this called Sambucus nigra, Aralia racemosa, and the Hipposalve bryanea. These are seasonal and very good medicines that can be given at a potency of 30 powers, and provided these should be taken on the this is called prescription of a doctor. It's better to have a checkup with the
it's better to have a check and then prescribe the medicines.
Yeah, prescribe the medicines.
Okay. But the symptoms which she mentioned and the medicines which you have mentioned, that is like prescribed for?
These are the preliminary medicines that can be prescribed, but provided proper assessment of the patient is a mandatory affair with us.
Okay, doctor, coming back to you again on the topic which we were discussing, that the common diseases, and you have mentioned, so are these kind of diseases and the patients are coming to you frequently these days?
Very frequently these sort of patients are coming to us.
So whenever they come to you, what is the first diagnosis? What is the first thing you do with them? You take out their history, as you have already mentioned. So please tell on that.
We first take a detailed history of the patient. And with us homeopathy, we take this part also into accountability. Then after we...
so you are saying that psychological part is also very important.
Mental and physical aspect is very important to us. And then after, if required, we go for investigative procedures. Because after that we simultaneously this prognostic and diagnostic approach we do. And after that, we choose a medicine on totality of the symptom, and it's a cure, basically.
So whenever they come to you and you'd ask them questions on related to their psychology, because they must be thinking that we are coming with some treatment, but why is doctor asking about our history and why is... But this is a part of your treatment.
This is a part
so you make them
integral
understand.
part of homeopathic treatment, basically.
So you make them understand.
We make aware of the thing that it's an integral part of our medication, and say its health is equilibrium between mental and physical health.
Absolutely.
So as such, these two faculties have to be taken into account. That's what.
And suppose when they come to you, is it difficult for you to make them understand? Because sometimes it's very much problematic for some patients to make them understand, because they will be rigid with their, no, you give me all the medicines for my treatment, but not these other kinds of things. So any kind of like incident happened with you?
These on and off happens because patients come to us with ailments. They have been suffering for long duration. So automatically their mental setback is at stake. So we have to reconcile them and make them confident of our medication. And that's where the medicine works, basically.
Absolutely. And it is also depend on the person to person, because if they are strong, then only the medicines work like magic, isn't it, doctor? So if we talk about the treatment of cold and cough in homeopathy, so how that is done?
The cold and cough, basically, seasonal on and off, the onset of any season, particularly a patient tend to suffer from this sort of problem. So few managements like avoid exposure to cold. At the end of the day, if somebody does plain steam inhalation or gargling with saline water, these are general this called management for this sort of thing, because and everybody is exposed to pollution, and that is one of the important cause of this called these ailments. So we after that we take account of the patient, we choose medicine and accordingly we prescribe. medicines
Okay.
for that.
It depends actually like what kind of lifestyle the person is leading,
Yes,
isn't it? And nowadays the lifestyle is so fast, everybody is so busy with their work schedule and they doesn't have time for their proper diet as well.
Yes, yes.
So does proper diet also play an important role for these kind of diseases, and what kind of suggestions do you give to them when they come to you?
Definitely, this sort of thing, ultimately, the deficiency of multivitamin, micronutrients and all, they tend to, this called, bring about this sort of, the more the immune system is being on the low key, then automatically the subject is to suffer from this sort of problem. So that's why I recommend healthy diets, so plenty of fresh fruits, vegetables, sprouts, grams and beans and like this.
Okay. So that
Plenty of oral fluid, because one of the important thing is water.
Water is
they
very
are
important.
the main thing to flush out toxins from our body.
So you suggest every patient whenever they comes to your diet,
These
you
are
should
the
have
basic
a proper
management that
plenty
is
of
supposed to
water.
be taken.
Okay, okay. And if we talk about some other kind of diseases, we have already had a word on cold and cough. So what would be that? Sinusitis or like then again asthma? So
Sinusitis again, there are few cavities on the nasal apertures. So these cavities are infected and inflamed with mucous membrane.
okay.
As such, with humidity, this sort of problem tend to aggravate. At night progresses, or in the morning things become bad to worse. And when day comes out, the patients are a little bit on the better side. So again, exposure to pollution, these sort of thing further aggravate the scenario. As such, again, the same thing at the end of the day, they are supposed to do this called steam inhalation to flush out the accumulated debris in the maxillary or frontal, whatsoever be the sinus. And further, our medicine, homeopathic medicines, will help them
And
get
too
rid
much
of
of
this
headache, doctor, what could be that signal to? Like a sinusitis or migraine?
Sinusitis, migraine, many other factors are there, brain tumor and all. So,
What about migraine? If we talk about migraine, so it is like a very problematic thing for someone. If suppose they have to go for a meeting, if we talk about any office goers or maybe a school or college goers, because it doesn't depend on the age nowadays.
Yes.
It can happen to any of the age, isn't it? So what would be that, like to have a basic cure on that migraine?
migraine basically is a neuralgic headache characterized by sensitivity of all senses. The sound, noise, smell, the sun becomes hypersensitive. Exact cause of migraine is basically not known.
Okay.
So, few predisposing factors like this called stress, too much stressed, then acidity is in the backdrop is one of the important cause of
Okay.
migraine.
Doctor will talk on that, but we'll have a phone call. Let's see whose call is this. Hello, who's calling?
Hello.
Yes.
Yeah, this is Rajiv calling.
Yes, Rajiv, put your question.
Yeah, actually, during winter days, I suffer from a skin problem. Like my skin, basically you can say dandruff problem, but it only occurs during winter season. Like during fall, winter, it starts and it will stay like up to March of the next year. So a bit of solution will be very helpful.
Okay.
Your age, please?
I'm 32.
Any sort of background diabetic or sugar pressure like that?
No. Everything is normal. Like my blood pressure is also normal, and I don't have sugar till now.
Okay, fine. Scalp
thank
is infested with dandruff.
Yeah. Scalp. Basically, the scalp gets infected, and also the skin. Means like you can say my skin's like hands and some parts of the ears also.
Basically, this is sort of fungal infection called seborrheic dermatitis.
Okay.
The infection has invaded most probably bloodstream and it's spreading in the other parts of the body.
Okay.
So here homeopathy has a good remedy. So proper this personal hygiene the scalp
That's very important.
has to be maintained. Persistently he has to use some anti-dandruff shampoos and all. Along with that, few medicines will help him, but proper analysis of the case
Proper
and
analysis
case history.
of the case. How much is the dandruff
definitely
or
will help
the
him.
anti?
For example, few homeopathic medicines like basilinum, this called sulfur, then Kelly iod. These are the few medicines. If taken in lower potencies, they will help But these two has to be taken in with proper medical supervision.
And you were talking about anti-dandruff shampoos, but the shampoos which is available in the market, are those prescribed, or it will be a medicinal shampoo?
No, medicinal shampoo. As far we are concerned, we have got very good brand of homeopathic anti-dandruff shampoos and anti-dandruff hair oils.
Because as you have already mentioned, it's a fungal infection, so
definitely.
you have to go
like
for
that.
the medicines.
And after proper this assessment, we can take up the case, and his problem will be eased off then.
Okay. Thank you for calling. And just to remind our viewers once again, our numbers are flashed on your television screens, and we have our doctor who is a homeopathist, and he is here to give you all the answers if you have any queries regarding whatever queries you have regarding homeopathy, how it works like magic if you follow it properly. So questions you can put on, because our numbers are flashed on your television screens. So put your questions to get all your answers on your queries. Okay, coming back to you, doctor, again, we were having discussions on the migraine thing, because you said that there is no proper thing to detect or something like that. Okay, we have a phone call. Again, we'll talk on that. Hello, who's calling?
Yeah, this is Preeti.
Yeah, hi Preeti. Yeah, hello.
Yeah, actually, I wanted to know that at times when we go to the doctors, like regarding asthma, sometimes they directly prefer giving medicines. But because I am an asthma patient, so some more doctors have also asked me to go for some allergy test. So I wanted to know, like, which is more important, because already because I was in medication of some other doctor, so I didn't go for the allergy test, but also I am not getting cured. So I asked, like, how important are these allergy tests in order to get cured of asthma?
Okay.
Ma'am, your age?
Yeah, I'm 28.
Okay. The thing is that once we assess you, then we can precisely tell you whether that allergic test is a mandatory affair then or not. After assessing patient personally, then it's said sometimes it becomes a mandatory affair, the allergy test.
Okay,
And
so
sometimes
usually it is necessary or not,
yeah,
doctor?
not 100% necessary, but at point of time it becomes necessary.
Depending on the case
yeah,
study.
definitely. So at the very onset, patient has to be assessed.
Okay.
Then you can say.
Okay. So depending on the case study, if it is necessary, then
Sometimes
doctors
it
will of
becomes
course
a
prescribe you.
mandatory
But
affair.
sometimes it's unnecessarily, some doctors may be telling or something like that. Does it happen anytime?
I don't
like, okay, fine. So doctor, coming back to the discussion again on migraine we were
Migraine,
having.
yeah.
Okay.
Actually, migraine, exact etiology of migraine is not known. Some predisposing factors we take into account. For example, this called thermal. So patient coming in contact with heat that tend to suffer from migraine.
Okay.
Patient coming in contact with this called cold, again attack of migraine. Coming in contact with, if exposed to rain and this aquatic urticaria.
So everything is related to migraine.
Related, the diet related. Diet, few say ingested food. And the other one, medicines.
Okay.
Some medicine also creates some sort of gas acidity in the backdrop, and thereby induces migraine.
And,
diet,
these are the, if we talk about the signs and symptoms also, it is related in that as well.
So, and say diet also, say gluten-free diet, we tell patient not to take this. These aggravate scenario. There too much intake of junk foods and all. This thing also brings up an attack of headache.
Okay, because nowadays if people are outside, then they prefer to have food or something like that outside. But it has been necessary to avoid those kind of food, isn't it?
The longer period of work, no proper diet.
Okay.
That's these are the things that ultimately.
Okay, doctor, we have another call. Hello, who's calling?
Hello. Good evening, sir.
Yeah, good evening. Hello.
Ma'am, it's me, Bimanjyoti Barman.
Yes. Put your question.
Can I speak in Hindi?
Yeah. He's hearing you. You can put your question and he'll be giving you answer.
Okay. Sir, namaste.
Namaste. Please tell.
Hello.
Yes. He's hearing you. Yes.
Okay.
Yes.
Sir, पिछले कुछ दिनों से मेरी लड़की, she is 2 years old and she is suffering from fever.
Fever.
तो हाँ, उसे थोड़ा बुखार सा रहता है, गर्म हो जाता है उसका फेस वगैरह. उसके बाद मैंने डॉक्टर को देखा, यार ठीक हो गया, लेकिन from last yesterday she is suffering also from that fever. So I don't know, sir, what to do. So please give me any suggestion.
Okay.
I couldn't follow.
You couldn't. Okay. आप अपना question थोड़ा फिर से बोलेंगे कुछ दिनों से.
हाँ कुछ है, बुखार हो रहा है, तो बीच में ठीक हो गया था, और उसके बाद फ्रॉम यस्टरडे
हाँ।
और मतलब बुखार स्टार्ट हो गया है।
अच्छा,
हाँ,
क्या एज होगा?
2 years old.
2 years.
बेबी।
बेबी।
Yes, she's good.
Frequent fever.
आपने टेम्परेचर नोट डाउन किया था?
टेम्परेचर सर 101
101।
उतना रहता है सर।
तो उसके साथ कफ कोल्ड कुछ है क्या?
सर पहले हुआ था, 15 days एगो पहले हुआ था, उसके बाद तो मतलब कफ वगैरह ठीक हो गया, लेकिन अभी जो है ना ओनली बुखार है सर।
उसका बाउल मूवमेंट, स्टूल या गैस एसिडिटी वैसा कुछ पेट का प्रॉब्लम है क्या?
जी नहीं सर, सब तो नॉर्मल है सर।
Okay.
जी।
So it's 2-year-old. The baby is 2-year-old. Okay.
At this point of time, it's very tough to assess. Basically, I think some sort of infection has crept up.
Okay.
Definitely. That's why things are relapsing.
Okay.
So proper.
Because she was fine, and again the fever came.
Yeah, definitely some sort of symptoms quite simulate some sort of urinary tract infection, some other thing might have crept up. That's why things it's under relapsing episode.
So in homeopathy, what kind of treatment do you suggest to these kind of patients when they come to you?
We physically she is so tender, no? So at this age, physical assessment along with this proper history of the patient has to be
Assessed, and
taken.
then only you can
then only we
prescribe
can take say the patient. Otherwise, you should consult a homeopathic doctor, and I think his problem would be solved.
And as there is no side effects, and it is very much necessary
very
for a
safe
kid.
for babies. So
Very safe for babies, actually.
Advisable immediately he should contact some homeopathic doctors so that his problem can be solved.
Okay, okay. Okay, doctor, then you were talking about that if anything related to cold or like rain or anything like hot, so it tends to migraine, isn't it? So
These are the predisposing
preliminary
factors.
symptoms we
Exciting
can
factors.
say.
Basically, they tend to bring about these attacks. Too much this exposed to work, no food, prolonged working hours. These also tend to, at the end of the day, exhaustion. This sort of thing
and the
tend to bring
main
about an
factor
attack.
these days is like stress. Stress is one of the most important factor which is leading everyone to other kind of diseases as well, isn't it? So on that note, whenever a patient comes to you, do you tell them or do you suggest them that stress factor should be sorted out and you should have a carefree and a free life? So for that, what do you like suggestion? What suggestions do you tell them?
We suggest them to go for at least a few, say half an hour, 45 minutes of walk, little bit of free and stretching, yoga and all. Keep the body abundant, filled up with abundant quantity of fluid. Water level, if it been there in the body, definitely all the toxins
and
will
maybe the
be
things which they
eliminated.
make them happy, they can do sometimes for that as well, isn't it? Okay, doctor, we have another call and we'll have to take that call. Hello, who's calling?
Yeah, I'm Anamika calling from Nalbari.
Yes, Anamika, yes.
Yeah, good afternoon, sir.
Good afternoon.
Yeah, sir, I'm having some, cholesterol kind of, flesh thing in my, I think it's a cholesterol in my eyelids.
Upper eyelids.
Yeah. So, how can I get rid of that?
Actually, this is medically called xanthelasma.
Okay.
And it's a mark on the upper eyelids. That, rather than cosmetics issue, it has no side effects. So at some point of time, it might have, there might be an elevated level of this called cholesterol. That's why things have been like this. So immediate this lipid profile has to be checked. That too in the fasting stomach.
Okay. And so that is the initial thing one has to do.
The very onset this has to be done. And after that, you see a good homeopathic doctor. And the proper case history and medicine will definitely help you to get rid of this problem.
Okay.
Definitely.
Okay. Because as she's a female, so she'll be concerned about.
It's very had adverse impact on the
not only
cosmetics.
females, but everybody would be concerned.
On the,
that's what.
Cosmetic aspect.
Okay, and if we talk about like other kind of diseases apart from the what we had discussions, cough, cold, asthma, and then migraine, so other would be like related to stomach as well.
Yeah.
So what would be that? There are so many things related to stomach, isn't it, doctor?
Yeah, prime thing that patient come to us clinic is gas acidity.
Gastritis and
stomach,
acidity.
gastritis, acidity, the belching, bloating, this sort of problem on and off patient comes with that. Basically, this is hyper secretion of acids in the stomach.
Okay.
And that again stress, anxiety, strain. The more the patient been on the stress level, strain level, the acids have been passively secreted on hypothalamus. The more the brain been excited, the more the acids been secreted.
Okay,
and
if the brain are more excited, then also okay.
Stressed, strained. The more the acids been secreted on the cephalic phase, and thereby creating acid gas. They tend to burn the intestinal submucous membrane. So,
Okay.
a long
So
duration of work, no food,
No proper timing of food.
proper timing. Even if we take food, that too, taking junks and all, there are things become
But
bad
this
to
is a
worse.
very like important thing to note down that things like having a stress life, that is most important. And also if your brain is excited, then also it
The more
tends
you are
to...
stressed, the more the acid been secretion. So, what we tell the patient, again, a session of exercise in the morning, so that you become cool and calm. Then intermittently you go on taking these or this, that stuff, so that there may be barrier in between the stomach and the acid level.
Right.
So, drink water, eat something at frequent intervals.
Okay.
And,
Not together, but at frequent
few
intervals. Okay.
homeopathic medicines are very good medicines. For example, Nux vomica, lycopodium, Asafoetida, China.
Okay. So this is related to...
These are few medicines, if taken in lower potencies, they act marvelous. That too,
okay.
has these medicines, and for a permanent cure, you better see a homeopath, and that would be a permanent affair.
Because it's very important like to suggest something, but before to that important is to study the case and then to know about the psychological part, as you have
Both the
already
things has
mentioned.
to be
Family history is very
corroborated.
important. Yes. And then you can prescribe it properly and the treatment would be done properly,
Yes,
isn't
yes,
it? And it will work as a magic, as you have been telling us clearly and from the start of our show as well.
Definitely.
Okay, doctor, this was related to acidity and also about the gastritis, which is a very frequent thing happening to every of the viewers and every of the person. And coming to you, maybe the patients are more in this type of
sort of
cases as
patients come to
well.
us.
Okay, doctor, we have a phone call, so let's take that phone call. Hello, who's calling? Hello?
Hello.
Hello?
মই শুনিছো
কওকচোন আপোনাৰ প্ৰশ্নটো
মোৰ প্ৰব্লেম হৈছে তাৰমানে কি মোৰ পিঠিৰো বিষ আছে মানে অলপ ঠাণ্ডা লাগিলে খুব বিষ মই ইমান থাকিব নোৱাৰো প্লাছ কফো আছে মোৰ আৰু পেটৰ প্ৰব্লেম আছে মোৰ কিন্তু এই প্ৰব্লেমকেইটা লাইট টেলিকাষ্ট হৈ আছে বৰ্তমান
Are you aware of the question?
No, partially I could hear.
Okay, okay. আপোনাৰ প্ৰশ্নটো অকমান লাহে লাহে আৰু আকৌ এবাৰ কৰকচোন
এটা মোৰ পিঠিখন খুব বিষায় অলপমান ঠাণ্ডা লাগিলে
পিঠিখন বিষায়
তাৰপিছত মোৰ এনেই মানে এজমেটিক ট্ৰাবুল অলপ আছে অলপ মানে কফ আছে থাকে নাই আৰু পেটৰো মানে ইমান গেছ হয় যাৰ মানে মই থাকিব নোৱাৰো
আচ্ছা পিঠিখন
আপোনাৰ এজ কিমান
আপোনাৰ এজটো কিমান হ'ব
মোৰ এতিয়া 67 কমপ্লিট
67
আপোনাৰ সুগাৰ আছে নেকি
সুগাৰ নাই সুগাৰ প্ৰেছাৰ তেনেকে নাই তাৰমানে নাই বুলি ভাবিছোঁ আৰু আগতে চাইছিলোঁ এতিয়া চোৱা নাই
আপোনাৰ মেডিচিন কিবা খাই আছে নেকি আপুনি
মেডিচিন খোৱা নাই কিন্তু মই এনেকৈ হেৰি এজমেটিক ট্ৰাবুলৰ কাৰণে এটা গেছ আছে মানে 2 টাইমছ মানে হেৰি ব্যৱহাৰ কৰোঁ বিষৰ কাৰণে খোৱা নাই
Okay, so he's having a lot of pain.
তেখেতৰ যি লাগিছে চেষ্টত কিবা ইনফেকশ্যন আছে তাৰ কাৰণে হ'ব পাৰে আপোনাৰ প্লিউৰেল এফিচিয়েণ্ট থাকিলে আপোনাৰ পিঠিৰ বিকটিক হ'ব পাৰে ইয়াৰ পিছত গেছ এচিডিটিৰ পৰা হ'ব পাৰে আৰু নাৰ্ভ ৰিলেটেড হ'ব পাৰে
So is it that everything is related together because he was also having a back pain and now stomach pain and now he's
quite simulates these sort of things what I told you. Either some sort of spondylitic problem that has crept up, and then gas that is exerting pressure on the this called diaphragm, thereby going to back. And as he is telling that he is having some sort of asthmatic problem. So it might be also one of the
And he's
causes.
67, so
at the
does the
extremely-
curing part takes time because of his age, isn't it? Is that
initially,
related?
some sort of investigative procedure has to be done to
Okay.
rule out this sort of any sort of pleural effusion and like that. So chest X-ray and a routine blood test.
All
This
right.
will guide us. And after that, if he comes to us or any homeopathic doctor, his
All right.
problem will be solved.
Okay, doctor, we'll have our conversation, we'll continue our conversation, but on that note, we'll have to slip into a short break. So viewers, will slip into a short break, but do come back soon because we have lots more on the other side of the break. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and I'm still joined by Dr. Manideep Dey, and we are talking and we are having a conversation on homeopathy, and there are lots of diseases which can be cured and made a magic regarding the homeopathy, and so I'll straight away move to him and talk more about the topic. So, Doctor, coming back to you again, earlier to the break, we were having a lot of discussions and a conversation, but right now we have a phone call. So first we'll take that phone call and we'll move to our conversation. Hello, who's calling? Hello? All right, we'll take that call again. There is a technical glitch is out. So we were having a discussion on the common diseases and signs and symptoms and how homeopathy works on it. And it's very important that whenever a patient comes to you, that a research and a proper case study is also very much important, isn't it, doctor?
Yeah.
And if we talk about homeopathy, doctor, homeopathy is something like that people were not knowing its benefits. But if we talk about the benefits of homeopathy, how it works like a magic, so what would you tell the viewers out there? How to believe and how to come to know it?
Homeopathy basically works on principle like cures like. So if sort of say if a person is suffering from disease, the symptoms that he manifests.
Okay, just to stop you in between, doctor, we'll take the call again and then we'll start our conversation. Hello, who's calling?
Hello.
Hello.
I'm Charlotte Patabo Richaro.
Sir, huni ase, apuni prashno to koribo.
Hello.
Huni ase, teo, apuni apnar prashno to koribo.
Hello, sir. Namaskar, sir.
Namaskar.
মই স্যার কোৱালকুছি বংশৰ পৰা কৈছো স্যাৰ মই ইন্দ্ৰকান্ত বৈশ্য স্যাৰ আপোনাৰ তাত আজিও মোৰ যোৱা কথা আছিলে আপুনি আজি মোৰ ডেটটো পিছাই দিলে মোৰ শ্ৰীমতী ললিতা ডেকা বৈশ্য আপুনি কাণৰ যিটো চিকিৎসা কৰিছিল স্যাৰ স্যাৰ চিনি পাইছেনে মই স্যাৰ বংশৰ পৰা স্যাৰ হয় স্যাৰ গতিকে আপোনাৰ প্ৰগ্ৰামটো দেখা পাই মোক খুব ভালে লাগিল স্যাৰ কাণৰ কিন্তু যথেষ্ট ভাল পাইছে আপোনাক স্যাৰ বহুত বহুত ধন্যবাদ জনাইছো স্যাৰ এই সুযোগতে স্যাৰ গতিকে স্যাৰ কাণৰটো আৰু দ্বিতীয়বাৰ আপোনাৰ তাত আজি যোৱা কথা আছিলে
ঠিক আছে
স্যাৰ
গতিকে
মই আপোনাক এটা ধন্যবাদহে জনাইছো স্যাৰ মোৰ প্ৰশ্ন বিশেষভাৱে জনোৱা নাই স্যাৰ আপোনাক বহুত বহুত ধন্যবাদ স্যাৰ
Thank you so much. Thank you so much.
So that was okay, thank you for calling. Okay, so maybe he has got his benefits. Okay, we have another caller, so let's take that call as well. Hello, who's calling?
Yeah, my name is Nabarun Dey.
Yes, Nabarun, yes.
I just wanted to, talk about my father, who is 81 years old. Actually, he is not having problems of sleeping at night. So he is having breathing problems. So basically, in terms of maybe in the nose, there is some kind of airflow passage problem. So is there any treatment? Wanted to ask him, and if there, because at this age we don't want any surgery to be done.
Okay.
Any sort of background, sugar, pressure, thyroid?
No, he does not have any minor pressure is there, but otherwise he is okay.
Okay, fine. He basically at night he can't sleep. Insomnia. Hello.
Hello.
Yeah.
So basically, at night he has a problem. He can't
this
sleep.
has been for a long time. I mean, about 8-10 years. So we want to consult homeopathy and see if there are any results.
Okay.
Okay. Actually, at this stage, right now, nothing can be clear cut been told. So proper this call he has to be assessed properly with the history, case history taking and all the physical and this mental prospect has to be simultaneously
Depends on the age.
taken. And many numbers of medicines are there with homeopathy. And I hope after proper assessment of the patient, definitely his problem will be eased.
But basically, if you want to suggest that person, the caller who has just asked the question, 82 years of age, it's quite a big age. So
these are extreme age, no?
Yes.
Children and extreme age.
Yes.
These has to be properly
so it's
assessed.
important to see the patient and
see
then
the patient and properly assessed, and then after proper selection of medicine, and definitely he would be cured. I think so.
Okay, okay. So I'm sure the viewer who have just asked the question must have got your answers, because 82 years of age and there should be a proper assessment. So any questions if you have to ask, you can come up to any of the homeopathy doctor and you will be assessed properly, your father will be assessed properly, and then the remedies will be given. All right, doctor, we have another call, so let's take that call as well. Hello, who's calling?
Mrs. Frida, hello.
Hello?
Yes.
Yes? Hello?
Yes.
Yeah, please ask your question.
SMS me.
Yes, yes. Apuni apuna proshno to koribo pare, doctor e huni ase.
Bar. Mur bhorit eta kon eta hochi. Aji pray 20-25 বছৰ মানে হ'ব। তাৰপিছত সেটো 5 times মই অপাৰেশন কৰিলো। কৰাৰ পিছতো মোৰ একো মানে কিয় নহল। নোমাৰ পিছত সেটোটো আছে। তাৰপিছত আকৌ আজি 4-5 মাহৰ পিছত আকৌ মোৰ খুব এটা কোন ওলাল। এতিয়া মই খোজ কাঢ়িবলৈ বৰ কষ্ট পাওঁ মই। ঔষধ খাই আছো। হোমিওপেথিক ঔষধ খাই আছো মই এতিয়া। সেইখিনি।
মেম আপোনাৰ এজ কিমান?
কিলা কৈছে?
আপোনাৰ বয়সটো কিমান?
মোৰ বয়স এতিয়া 68 হ'ল।
58. Weight বেছি নেকি?
আপোনাৰ
নাই।
weight আচ্ছা।
কওকচোন।
ওজনটো বেছি নেকি আপোনাৰ?
নাই। মোৰ খুব ওজন পাতলে মই খুব ক্ষীণ।
ঠিক আছে।
মানে আগৰ ডাক্তৰে মোক কৈছিল যে মোৰ মানে বেলেঞ্চ নহয়।
আপনি এনে মেডিসিন ভালকে চাই কিনে মেডিসিন দিলে ডেফিনেটলি ভাল পাব। আৰু আপনি কেইটামান মেনেজমেন্ট কৰিব, যেনে সফট আপোনাৰ সিলিকন সোল স্যান্ডেল পিন্ধিব লাগিব, সফট স্যান্ডেল পিন্ধিব লাগিব, লম্বা সময় থিয় হৈ নাথাকিব, সুদা ভৰিৰে আপুনি চলা ফিৰা নকৰিব। এই মানে আগত সেইবিলাক বস্তু কৰাৰ কাৰণে চাগে হৈছে। তো এইকাৰণে এইকেইটা বস্তু আপুনি কৰিব ভালকে, আৰু কাৰোবাক ভালকে অলপ হোমিওপেথিক ডক্টৰক দেখাওক, ট্ৰিটমেণ্ট হ'ব। আমাৰ ভাল ট্ৰিটমেণ্ট আছে ইয়াৰ।
হয়।
ঠিক আছে।
মইতো এইকেইদিন যাব নোৱাৰিম, অলপ দেৰিকৈ গ'লে হ'বনে বাৰু?
হ'ব।
এই নাতিনীটো পৰীক্ষা আছে, যাম মই।
ঠিক আছে।
ঠিক আছে। ভাল পালো।
All right, so maybe whatever the questions, and there were lots of queries, because like some people have lots of queries to ask on that. Okay, we have another call, doctor. Let's take that call as well. Hello, who's calling?
Hello, asu.
Apunar proshno to koribo?
ঠিক আছে।
Hello?
Hello.
Doctor e khuni ase, apunar proshno to koribo.
হয়। মোৰ এই গেষ্ট্ৰিক আৰু হেৰি থাইৰয়ড, ইউৰিক এচিড। কৈছো হেৰি থাইৰয়ড, ইউৰিক এচিড আৰু হেৰি গেষ্ট্ৰিক।
এইকেইটা প্ৰব্লেম হৈ আছে।
হয়।
আপোনাৰ সুগাৰ আছে নেকি মেম? সুগাৰ?
আপোনাৰ সুগাৰ আছে নেকি? ডায়াবেটিস?
নাই, সুগাৰ নাই মোৰ।
ঠিক আছে। আপনি থাইৰয়ডৰ আৰু ইউৰিক এচিডৰ মেডিসিন খাই আছে নেকি?
নাই।
একো খোৱা নাই?
নাই।
আপোনাৰ TSH লেভেলটো কিমান আছিল লাষ্টত?
হয়, মেডিসিন মই গুৱাহাটী প্ৰমোদ দাসত দেখুৱাইছিলো।
Achha, maybe she's not knowing about that TSH level.
Okay, fine.
Okay. Okay, so what suggestion would you like to give her, doctor?
Actually, thyroid, I don't think she is on medication, what she told. So even if she is under medication, say allopathic and all, so let her pursue with that. And uric acid, both for thyroid and uric acid, we have good numbers of medicines.
Okay.
For thyroid, say this misfunctioning of the thyroid gland, thyroxine hormone, the hypofunctioning of the thyroxine hormone leading to the hypothyroidism. That might be heart disease. So they are also, in that case also we have very good medicines for thyroid. And regarding uric acid actually this production of purine metabolism somewhere is at stake.
Okay.
So definitely it's production is more and elimination is less. And it's been retained in the body. And that's why see the patient initially perceive pain initially on the metatarsopharineal joint, this ankle, knees and all. So for this thyroid, this is called hyperuricaemia. So low protein diet and plenty of water fluid again to flush out accumulated toxins in the body.
All right.
And along with that, homeopathic medicine. It's a cure.
Okay. Oh, we have another call, doctor, so let's take that call. Hello?
Hello.
Yes?
মই সত্যজিৎ দেৱ কৈছোঁ।
প্ৰশ্নটো কৰিব।
মানে কি আমাৰ মাহী এজন আছে। তেওঁ মানে কি হৈছে বহুত দিনৰ পৰা মানে কাহ হৈ আছে, 7 বছৰ 8 বছৰ। কাহ হৈ আছে মানে কি মেডিচিন কৰি আছে, তাৰপিছত মানে এক্সৰে এইবিলাক, তাৰপিছত MRI কৰা হ'ল, তাত দেখুৱাইছে মানে কি ব্ৰংকোভাস্কুলাৰ ডিজিজ বুলি দেখুৱাইছিলে। হোমিওপেথিক ট্ৰিটমেণ্ট কৰিম বুলি ভাবিছিলে আৰু এই ছাৰৰ ওচৰত গ'লে ভাল হ'ব নেকি এইটো জানিবলৈ কাৰণে ফোন কৰিছোঁ।
এজ কিমান তেখেতৰ?
এজ হ'ব আপোনাৰ 41।
40 কিমান বছৰ হ'ল ভুগি আছে তেখেতে?
হৈছে আপোনাৰ 7 বছৰ হ'ল।
7 বছৰ। এতিয়া কি ট্ৰিটমেণ্ট চলি আছে তেখেতৰ?
এনে চেন্নাই এপলত গৈছিলে, এপলত গৈ পেলাই তাত ট্ৰিটমেণ্ট কৰিলে, কৰি পেলাই কেইদিনমান মেডিচিন খালে, তাৰপিছত 1 বছৰ 2 বছৰমান খালে, খোৱাৰ পাছত আকৌ এই মেডিচিন খালে ভাল থাকে, আকৌ নহ'লে হৈ যায়।
জ্বৰটো থাকে নেকি তেখেতৰ?
জ্বৰটো তেনেকুৱা নাথাকে, কিন্তু মানে দিনটো হ'লে কাহ ইমান নাথাকে, ৰাতি হ'লে কাহ হয়।
ৰাতি আৰু ৰাতিপুৱা কাহটো বেছি হয়?
হয়, ৰাতি বেছি কাহ। এনে কফো নোলায়, এনে ধৰক থাকে আৰু মিউকাছ থাকে।
ঠিক আছে। Again, some sort of investigative procedure. He has to do some sort of investigative procedure. Along with that, our medication and some dietary restriction definitely is problem.
Okay. So, doctor, if these kind of patients and the ones who are asking us a lot of questions, so if they want to come and see you, so what would you tell them and where they can come and see you? Because everyone is like willing to come to see you and get the proper medicines, because you are not able to tell them because you have to study the case and then you have to come to know and then only you can prescribe it.
The last phone call which we have attended, these are all perennial problems. No? Over phone you can
over
say
phone
anything.
it's not
so it's
able to.
One-to-one in person. This has to be clinically correlated and proper history taking. Then after, I think definitely their problem will be history.
Okay.
Our clinic is at GS Road, opposite Anil Plaza. Homeo World it.
Okay. So if anybody have any kind of problem and if one they want to come and see doctor, though his clinic is in GS Road and it's just opposite to Anil Plaza.
By number 3.
Okay. So any of the queries if you want to ask, you can come and meet him and then you can put your questions and then he can prescribe you with the proper medicines and proper diagnosis will be done for you. Okay, coming back to you, doctor, again, we were having a discussion on homeopathy and its benefits and we'll do that, but again we have a phone call, so let's see who's this. Hello. Coxon.
Hello.
আপনি
ডক্টৰৰ লগত কথা পাতিম অলপ।
ডক্টৰ শুনি আছে, আপোনাৰ প্ৰশ্নটো কৰিব।
হেল্ল'।
প্ৰশ্নটো কৰিব।
আচ্ছা, মোৰ এটা প্ৰব্লেম আছিল। প্ৰব্লেম হ'ল মোৰ মানে লেট্ৰিনটো ক্লিয়াৰ নহয়। হেল্ল', মুখত তিতা কৰি থাকে। কিন্তু কি খালে এইটোৰ পৰা ৰেমেডি পাম?
মুখত কি হয়?
মুখত তিতা লাগি থাকে, মানে পেটত গেছ ফৰ্মেশ্যন হয়, লেট্ৰিন ক্লিয়াৰ নহয়।
ওকে।
খালে আপোনাৰ প্ৰব্লেমটো বাঢ়ে নেকি না খালি পেটত আপোনাৰ প্ৰব্লেমটো বাঢ়ে?
খালি পেটত নহয়, এনে খালেও মানে পেটটো ফুলি থাকে, মানে গেছ ফৰ্মেশ্যন হয়, মুখত তিতা কৰে, লেট্ৰিনটো ক্লিয়াৰ নহয়।
আপোনাৰ বয়স কিমান?
47।
ঠিক আছে।
খালি পেটত নহয়, এনেই।
ঠিক আছে।
Okay. So
Actually, again, the acidity gastritis part that we
which we're having our discussion on that.
It might be the things are acid reflux is there. Gastritis with acid reflux, acid coming out. Anything wrong with the stomach tend to manifest over the entire oral cavity, no?
And depends upon the intake of fluid also.
Yeah. So he to require some sort of medication along with that. Intermittently, he should be to make an acid barrier. He should take this or that thing at little bit interval. Gluten-free diet, exercises, and morning walks. And along with that, few homeopathic medicines like again the Nux bomb, China. This called Lyco, Calcarea, Natrum salt. These sort of medicines and some sort of liver supportive he has to take.
Okay.
And for precise treatment, he has to see a homeopath doctor.
And then only suggestions can be given properly. Okay. We have another call, doctor, so let's take that call. Hello?
Hello?
Coxon?
Hi, মই কোথাও কথা পাতিব বিচাৰিছিলো
Sare শুনি আছে আপুনি আপোনাৰ প্ৰশ্নটো কৰিব
স্যাৰ মই প্ৰণৱ বৈশ্য স্যাৰ কপালকুছি বংশৰ পৰা
কওক
স্যাৰ ভাল লাগিল আপোনাক আজি দেখা পাই স্যাৰ খুবেই সুখী স্যাৰ মই আজি বহুত
থ্যাংক ইউ সো মাচ
স্যাৰ তাকে মানে আপোনাক দেখা পালো হঠাৎ এনেকুৱা স্যাৰ প্ৰব্লেমটো হেইটোৱে স্যাৰ মানে মই এবাৰ আপোনাৰ লগত কথা পাতো ভালো লাগিল গোটেইখিনি
থ্যাংক ইউ সো মাচ
আপোনাৰ কিবা প্ৰব্লেম যদি আছে প্ৰশ্নটো কৰিব
হয় প্ৰব্লেম মানে ছাৰৰ লগত ঘৰুৱাই হৈছে এতিয়া প্ৰব্লেম নাই ছাৰৰ মানে মোৰ মূৰৰ ওপৰত ছাৰৰ হাতখন থাকিলে হ'ল আৰু
all right so that's a very generous thing to give a call and it's a very like thanksgiving call for you as well doctor
thank you so much.
So that's the things like when patient comes in to you and when the medicines work like magic so these kind of calls as well come to you and it gives you immense pleasure isn't it doctor?
Definitely I do have very high patients of high rapport. They're very good patient. They abide by us. They follow our instruction, and thereby patients are getting cured.
Okay. So it is the belief on homeopathy which people are coming to you and they are believing on homeopathy and they are thinking that this also works like magic.
Yes,
so my another question would be a confusion might be in other minds as well that whenever if they are taking an allopathic medicines as well and when they come to you so do you ask them to stop that medicines and take up the homeopathy or does it like can be taken together or you have to tell them to fill up the course of that
depending on the intensity and severity of the patient so generally what abruptly you can withdraw any sort of medications
absolutely
simultaneously we start our medication with other system of medicines. Rather, we tell them to maintain a gap of say 1-2 hours. Gradually, we withdraw those medicines. Abrupt withdrawal of medicines will bring about an undesired side effects. No, so simultaneously these two medicines can be taken
depending on the time taken of the medicine, and then you suggest that
gradually we withdraw those medicines.
Okay, doctor, we have another call. Hello. Hello.
মই ডিব্ৰুগড়ৰ পৰা কৈছিলো ন
কওকচোন
মোৰ এই প্ৰব্লেমটো যে কাহ হৈ আছে এটো কাৰণে ছাৰৰ লগত কন্টাক্ট কৰিব পাৰি নেকি ডাইৰেক্ট
স্যাৰ শুনি আছে আপুনি প্ৰশ্নটো কৰিব পাৰে এতিয়া আপোনাৰ কি প্ৰব্লেম হৈ আছে
মই টিভি শ্ব'টো চাই আছো মানে
আপোনাৰ টিভিৰ ভলিউমটো অকমান কমাই ল'ব আৰু প্ৰশ্নটো কৰিব তেওঁ ইয়াতে বহি আছে আপোনাক এনসাৰটো দিব পাৰিব কওক আপোনাৰ প্ৰশ্নটো কৰিব যদি কিবা প্ৰব্লেম টিভিৰ ভলিউমটো কমাই ল'ব
হয় স্যাৰ মই ডিব্ৰুগড়ৰ পৰা কৈছো মোৰ 55 মোৰ আজি 15-20 দিনৰ আগতে জ্বৰ হৈছিলে তাৰ পৰা এতিয়া কাহ
55 এতিয়া জ্বৰ নাই এতিয়া
এতিয়া জ্বৰ তাৰপৰা কাহটো মই কফ নোলায় এতিয়া
গলটো হুৰহুৰাই থাকে নেকি
গুৰগুৰাই থাকে ভাল হৈ যায় আকৌ মানে গধূলি টাইমত ওলালে মানে ৰাতিপুৱা টাইমত কাহটো ধৰে এবাৰ
খেকা টেকাৰ ওলাই নেকি কিবা
কফ নোলায় তাৰমানে শুকান কাহ
নাকটা খোপা মাৰি ধৰে নেকি
নাকটো খোপা মাৰি ধৰে ধূলিৰ প্ৰব্লেম নেকি এলাৰ্জি টেবলেট মই খাই আছো এতিয়া বৰ্তমান
ঠিক আছে ৰাতিকে কাহটো বেছি বাঢ়ে নেকি
ৰাতি গধূলি সময়ত হয় হয়
ঠিক আছে
Okay.
This is a case of this allergic most probably throat oriented cough. Might be not sure about that, might be allergic pharyngitis or like that. So his cough is confined to throat only. So plain steam inhalation, gargling, and this called further
Which are the best home remedies?
Avoid further exposure to cold. And few homeopathic medicines like Costicum 30, Rastox 30, Phytaloca 30, these are very good medicines.
Okay.
And lower dilutions if being taken, definitely these will act magic. But he who what the symptoms suggest, he should consult a homeopathic doctor.
Okay, okay. So it's better like when they come to you and you tell them and you prescribe them their medicines, then they have to take it on proper time, isn't it, doctor?
Definitely. Definitely.
And
Any
proper
medicine.
timing, proper following the routine of the diet and having a physical activity as well gives them an immense thing. Yes, isn't it, doctor?
Yes, yes.
Okay. So we are having a good number of calls. Okay, we have another call, so let's take that call as well. Hello. Apna prashna to koribo. Hello.
কি কৈছে মই বুজি পোৱা নাই
আপোনাৰ যদি কিবা প্ৰশ্ন আছে ডক্টৰ আমাৰ ষ্টুডিওতে আছে তো আপোনাৰ ফাৰ্স্ট অফ অল আপুনি টিভিৰ ভলিউমটো কমাই ল'ব আৰু প্ৰশ্নটো কৰিব
প্ৰশ্নটা মোৰ যেতিয়া গাটো মানে খুজে খুজে হেৰি একেবাৰে তেজ ওলাই যায়
গাটো খুজাই খুজাই
খুজে পেলাই তেজ ওলাই একদম ঘাঁচা হৈ যায় তাৰমানে তাতে
কিমান দিন হ'ল আপোনাৰ প্ৰব্লেম
মোটামুটি একমাহ সমান হ'ল আৰু এনেকুৱা হৈয়ে থাকে মোৰ মাজে মাজে তাৰমানে ভালে নহয়
আপোনাৰ বয়স কিমান আপোনাৰ
There's a lot of noise, so this is the thing, like you can reply it in her comfortable language as well, doctor. If she has asked us in Assamese, so you can reply in Assamese as well, so then only she'll be coming to know.
Yeah, definitely.
Okay. So what would be there? What suggestions would you give to her?
It's sort of some this called atopic dermatitis, a skin-related problem. So proper again coming to same point.
Diagnosis
right now, a proper diagnosis has to be done with some sort of investigative procedures.
And a proper hygiene maintained is also very important.
Personal hygiene maintained. This wearing, this using some sort of antifungal soaps and anti-dandruff shampoos. Along with that, immediate. I think it's a month standing affair. So she should go for investigative blood investigative procedures, and after that. Medication.
Okay. So doctor, we are like short of time, but if you, I would like to tell you that, to tell the viewers that what are the last things and what are the important mentioned things you want to tell the viewers about homeopathy, and what would be that? What suggestions would you give them?
Homeopathy, so far we have been seeing it's very safe, very gentle, permanent, and if medicines have been selected on the perfect angle, then it's a permanent cure. Instant, permanent, and it works a
It works like a magic, as you have been saying since this show has started. Okay. Thank you so much, doctor, for coming to our show. It's a privilege to have you, and we had a lot of good discussions. We are short of time. We had more questions to ask to you, but just to tell our viewers once again that we had a good show on homeopathy, and with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Wednesday at 4 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.